And welcome back. Okay, it's short season, and you may not be super happy with the look of your legs, but you got to stay cool, right? Sometimes for people with varicose veins, the symptoms get worse when the heat goes up. Dr. Deborah Mangione and Dr. Scott Stanwyck are back from the Wisconsin Vein Center and Medi-Spa with information and solutions for those painful, annoying veins. Good to see you guys.
Thank you.
I think this is great because a lot of people notice it most here in the summer because we're showing our legs.
Right.
But there's a reason they might also be feeling it more in the summer.
You know, the heat actually can make the veins dilate, and that really can cause more of a throbbing sensation. It can lead to more swelling in your legs. And so summertime really is a time when people who have venous insufficiency, veins that don't work right, actually their legs may look worse and feel worse.
So what are some of the symptoms? If somebody says like, okay, I know I have unsightly spider veins that I can see, but what are some symptoms that I might be feeling that there's a problem?
Well, if they have aching in their legs, if they have swelling at their ankles especially, or up into the calf of the leg, if they have restless legs at night, if they have leg cramps at night, all these things can be symptoms of venous insufficiency or veins that aren't working properly.
So how do you find out? How do you know? Because I think a lot of people will say, oh, well, I was out gardening, or I was out swimming all day, or I was
tired.
So my legs are sore from that, but that's not it.
Leg fatigue at the end of the day really doesn't happen with age or because of activities, which a lot of people think. This isn't something that hurts because you're going up and down stairs. This is something that just hurts because you've been standing or sitting for long periods of time.
Yes.
And so the best way to find out is to come in for a consultation and have an ultrasound, and that's our diagnostic study. And it's painless, and we do it with you standing up, so we see the effects of gravity, because the veins are the vessels that are draining your legs. So it's after the oxygen's been removed to go to the muscles, then the blood has to go back up to the heart and lungs to be recirculated, and this shows when a vein isn't working properly, blood is actually refluxing down the leg,
like
going
bulges.
backwards. And you get bulges in the vein because it gets dilated because it's holding more blood than it should.
So it's almost pooling there.
It absolutely is pooling there, and that's what gives the symptoms.
So don't you need these veins? I mean,
Well,
I think that's what everybody wonders, right? Because they're like, well,
that's right. Well, the veins we're talking about are the superficial veins of the leg. So they're the veins that are not underneath your muscles. They're not the major draining veins. They're just the collecting veins. And so if they're not working, you want to get rid of them so you make the other veins more efficient, because there are loads of veins in your legs, and they interconnect. And if we get rid of the bad ones, then the good ones actually work better.
So there is a cosmetic aspect, and then there's also a very medical aspect.
There's a medical aspect, because if you don't treat these veins and you do have swelling in your legs, that gives you about a 20% chance of getting ulceration eventually, these sores that don't heal, and that can be a real problem.
I've told you, I've done sclerotherapy on my
spider veins,
and I can attest to the fact that I used to have achy legs, I used to have restless leg syndrome, I had all that stuff, and I thought it was just normal.
Right.
It's not. It's gone.
Right.
It's fully gone.
Right, and even
I don't
spider
have it
veins
anymore.
can do that. That doesn't necessarily mean that an insurance policy will cover that, because they don't cover spider vein treatment, but they do cover other venous problems, like if you have big varicose veins.
Scott, what do you want to say?
Well, I just want to say I'm married to Debbie, but and it's why it's good to have somebody in the business be a relative or a wife, because I was an orthopedic surgeon. I had terrible leg pain, and I thought I had spinal stenosis. And Debbie just said, come on in, I'll check an ultrasound. I would go out in the barn to do some woodworking, and I couldn't stand for more than 5 or 10 minutes, have to sit down.
Did
Debbie
you think
did
it was because you were just
ultrasounds.
standing all the time?
Well, probably as a result of it, but you know, there were no visible signs. I had no varicosities, but when Debbie did ultrasounds of both legs, took care of both legs, and that was 8 or 10 years ago. I have no pain whatsoever in my legs.
And the procedures were pretty easy.
The procedures are simple.
Yeah.
I mean, compared to when I was in medical school and used to tear these things out, it was a bloody mess. Now it's nothing. It's a little pinprick.
Well, and I think that's what, I'm glad you said that, because that's what a lot of people think of. Right. They think of, you know, when they look at pictures like this, they think, oh, it's going to hurt that old stripping. That's right. And that's not the way it is anymore.
So this kind of thing we can accomplish just through some needle punches with local anesthetic. In about an hour, somebody comes in, has a procedure, can walk out, resume normal activities. You know, we just limit them to kind of less heavy lifting and real strenuous exercise for a couple of days. And then they're totally back to normal.
I love it. So people got to stop in, because you can do a quick ultrasound, find out if your veins are really what's causing the problems here. So again, if you're having swelling, fatigue, itching, nighttime cramps, restless legs, aching, all those things are not normal. Call Wisconsin Vein Center and MediSpa, 262-746-9088, wimedispa.com. They will not feel like that anymore if this is the cause and you get it taken care of. It truly does change your life. So thanks, you guys.
Life-changing for sure.
Appreciate it. Nice work.
Nice to see you.
You did good, Scott.
Our unexpected guest.
Yeah, I love it.